Wow. So what about heart disease? You were talking about people that have heart issues?
Yeah, we have a number of patients with heart failure that have responded quite well.
Heart failure.
So
heart attack, need of a transplant, that kind of thing?
Yeah, on transplant lists and that sort of thing, yeah. So
I have a friend who's on a transplant list.
Yeah, right. So there are different kinds of heart failure, and the interesting thing about heart failure is the cells don't need to go to the heart and to actually become new heart cells and that sort of thing. It's actually the secretions of the cells. Like I said before, there was a study at University of Buffalo where they injected cells IV in a hamster model of heart failure, and then they looked in the heart, and there were very few cells, but the heart failure got better. And then they said, let's inject those same cells. These are umbilical MSCs. Inject them into the hamstring muscle, and they demonstrated that none of the cells came out of the hamstring muscle, and yet the heart failure got better. So then they took just the juice, the liquid that the cells secrete, and they simulated the amount of juice that the cells would have produced in the body, and just injected the juice, and the heart failure got better. So it's really the secretions of the cells stimulating the natural repair, augmenting the natural repair process of the body that has been stretched to its limit. You know, if you have a 65-year-old, those cells aren't dividing very well. The juice can help the cells divide faster and produce more repair molecules and make it better.
So do you think that it could take someone who's on a heart transplant list and literally fix their heart?
I've seen it happen time and again.
Wow.
And there are clinical trials using similar cell types that also have demonstrated that. You know, there's a molecule called BNP, which is high in heart failure. The BNP came down in every single case. The ejection fraction, which measures kind of like the efficiency, how much blood your heart's pumping on each stroke, went up in every single patient. You know, I think in the book, the craziest case was a gringo who was down in Costa Rica, and he was already, I don't know, he was probably 25% routinely, but he got a viral disease or something else, and he was 11% ejection fraction. Normal is about 60. And the regular hospital, who worked a lot with us with our spinal cord patients and seeing results, seeing people walking again, they just said, you can't get on a plane. You're at 3,700 feet. If you get on a plane, you'll be dead. You might as well go see these guys over at the stem cell place and see if anything can happen. And I think his case is in the book as well. But he went from, 11 to 42 or something like that. But he wasn't the first case. The first case was a doctor who's a friend of Georgie's, friend of Dr. Paws, our medical director, who had congenital. So his mother had died of heart failure. His sister had died. His brother had died. And he was, not even 50 years old, and his ejection fraction was, hovering around 30%. And a lot of people at an advanced age, you're not even going to get on the list, because if you're a 50 or 60-year-old and there's a 20-year-old ahead of you, 20-year-old's going to win. And so he begged and begged to come down. He was our first patient. We didn't even really want to take him because we didn't know what was going to happen, because nobody had ever done it. And we treated him, and he went back, and he had a ejection fraction, he had an echocardiogram, and it was 52%. And then the doctor didn't believe it, so he redid it a month later, and it was 55%. So, it's not, I don't think it's for every case. I mean, you have people with like a super bad heart attack, and there's not enough to repair, and you really need a heart transplant. But I think you're going to see that it's ultimately, I think in 20 years, you're probably going to see standard of care for diseases, chronic diseases, like any chronic degenerative disease for which there's no good treatment. You're going to see standard of care is going to be young, healthy mesenchymal stem cells. Because if you look at the root cause, I get a question a lot, how is it these things work for so many things? Well, when the root cause is a lack of or dysfunction of those cells, then it makes sense that replenishing those or restoring them with young, healthy ones could be a useful treatment.
Well, Mel, this is so important to you that you wanted to come on and talk about this. You wanted to let people know about this shit.
Yeah, I think it's amazing, and it seems a crime to me that, it isn't easier to do in this country where, we're an advanced country. I mean, they should look a little harder at it, and it's a mystery to me why it isn't the case. But, hey, if there are places where one can go and get some help, it's good. I mean, I know a gal, she's a good friend of mine. She tore her shoulders up because she was like an athlete, and she had her shoulders done, and she got some dropped into her, and it actually helped greatly with an autoimmune disorder that she had, and then she was able to have kids. It was that kind of thing, you know. So,
yeah, there's some really good animal data showing that you can inject these cells and you can take ovarian failure and reverse it. And in her case, she had an autoimmune disease, and she was unable to have children, told that from a very young age. And after treatment, she got pregnant pretty quickly.
This sounds almost too good to be true. This is almost like skeptical people that are listening to this right now are probably like, what? This fucking shit cures everything?
Yeah, it sounds like the old spruiker on the corner. Good for moles, holes, and pimples on your what's.
But you've got studies. I mean, you've got real trials to back this up, and you've got a host of patients that are healed up and healthy.
Yeah, totally.
I don't even have anything wrong with me. I want to go down there and get shot up.
Well, if you see a 92-year-old man who's about ready to kick the bucket, and he's almost 100, he's going to celebrate 100 years in August. So, and
that's incredible.
He's better off than he was. Let me tell you.
Yeah, this young guy with Duchenne's muscular dystrophy, you know, the cells don't last forever. This is also an important point. With Duchenne's, it's a genetic defect, so they're missing a protein, and these cells go in. This in animal models. These cells, you give them to the animal, they go into the muscle, and then they start secreting that molecule that they're missing. But they only last for about 4, 5, 6 months, and then they start maturing, and then the immune system clears them. It's a real important point. You don't have that with embryonic stem cells because they cause tumors and things like that. And the great thing about these cells, they don't cause tumors because they differentiate. They don't want to be a baby. They're just there to do their job, which is to keep homeostasis, keep the immune system controlled, can help with regeneration, all that sort of thing.
Yeah, talk about that, but the embryonic stuff, because I find this interesting. The embryonic stuff is full of weird anomalies and stuff, right?
Yeah, a few of us got together and wrote an article when they finally put the clamp on the last embryonic stem cell treatment, and we've been saying for years that embryonic stem cells aren't going to work because they want to become babies. Their number one problem is they want to become babies. They don't want to. These cells, the cells that we start with, they don't want to become babies. The baby's already born. They're mature. They're mesenchymal, and that's what they are. And they're never going to be anything else. Whereas the embryonic stem cells, the biggest problem with them is they always form tumors. They form teratomas. And so in order for them to be functional, you have to grow them out. And if you want them to have MSC-like qualities, you have to force them to become MSCs. And then you have to make darn sure that there aren't any, if it only takes one. If there's one left, then it's going to form a tumor. So that was the big problem, that the expense, it was $300,000-$400,000 a dose just to make sure that they didn't have one in them. And then they weren't as beneficial, and they've been monkeyed with in the lab from when they were embryonic, and then converted and converted and converted and converted, and then grown up in huge numbers. And so they were monkeyed with. And these cells, you don't have to monkey with them. They just do it naturally. You just take them out, you digest them, you put them in a nutrient broth in the right temperature and humidity and oxygen levels, and they just grow. And so we wrote an article about embryonic stem cells. We call it the king is dead, long live the king, because the California voters knee-jerk $3 billion towards embryonic stem cell work, against the Bush administration's restriction of spending money on embryonic stem cell research. It wasn't banned, as most people said. All they said was, we're not going to use taxpayer money, federal taxpayer money, to go towards that. And what people heard was they don't want progress. Well, what's happened is at last count, I think they spent $2.75 billion. They got $250 million left. And guess what they're studying now? Adult stem cells. They're studying umbilical cord stem cells. They're studying mesenchymal stem cells. They've completely cut out everything on the embryonic side because it just took that long. There was so much misinformation out there, and now, thank God, it's gone. And we regained our sanity, but we blew a lot of dough on the whole embryonic thing.
Oh yeah, it was a lot of money, and we paid as taxpayers in California for that, because people were misinformed.
So, if a person's listening to you right now and they've got some issues, what's the first step they should take?
Well,
Like, say a guy's got a blown knee and is thinking about getting surgery.
yeah. Well, they could go, our website is cellmedicine, CELLmedicine.com for Panama. If it's something that can be addressed with bone marrow in the U.S., RMIclinic.com, that's our...
But the bone marrow is just not as effective.
Well, it can be. It's hard to say because everybody's bone marrow is different. Your age is different. If you're 85 years old, even if you're 65 years old and you're a smoker or you're diabetic, I don't think it's worth typically using your bone marrow because it's just not going to do a lot. But younger people, healthier people, a lot of times you can, when it's in a joint, because that's the only thing we can do in the U.S. is orthopedics. So,
right.
But if it's an orthopedic problem, then they could check out, see if they could, we could do something for them in Dallas. If it's not orthopedic and you need systemic treatment for autoimmune disease, if you have a spinal cord injury or autism, any of those conditions, then they go to cellmedicine, CELLmedicine.com, and that's where we have. There's all the information there, and they can fill out an application. The doctors get back with them and get in the system.
Now, how difficult is it to go down to Panama and get treatment? Like, how do you schedule that?
Well, that's all taken care of. There's a whole team of people that do that. The only thing is you need a passport, and there's no visa required or anything like that.
How long is that flight?
From LA, it's 6 hours. It's way far east, so it's like two.
So it's like going to Miami.
It's like 2 hours. Yeah, it's actually a little over 2 hours from Miami. So because it's way east, it's almost due south of Atlanta.
It's closer to New York, right? Is that a 4
Yeah,
hour
it's five
5 hours?
4.5, 5 to New York, probably something like that.
So cellmedicine.com, they go there, contact you. Now, do they need to have some sort of a consultation with a local doctor, an MRI, or anything like that before they go to see you?
Oh, yeah. They need to have a diagnosis from a physician for what they have. And then, that we have a team of doctors there, and they'll talk to them and see what they need. If they need any other information, they need any other, x-rays or MRIs or whatever, they'll sort all that out.
This is all fascinating stuff, man. And I never thought about going to Panama until about an hour ago. Now I'm thinking of taking a trip.
Be there in 6 hours.